For over 60 years, the ARC Alliance has been in your community, providing support and services for families and individuals with special needs. From birth through life, the ARC Alliance team of experts and specialists are here to find solutions to your needs.
For years, we felt alone as we take care of our son. The ARC Alliance support team brings compassion and understanding to our family and provides hands-on solutions.
The ARC Alliance, we're here to help you today. For more information, call 610-265-4700 or visit thearcalliance.org.
Welcome to the ARC Alliance's Bridges in the Community. I'm Nikki Krelovich, the Executive Director of the ARC Alliance Foundation. Today I'll be your host for a discussion with Paul Stengle, the CEO of the ARC Alliance. But before we begin, let me tell you a little bit about the ARC Alliance's history. The ARC Alliance was established in 1951 by a group of concerned parents, and today we remain a family-friendly organization. We provide a variety of support and services to individuals and their families, ranging from early intervention, supporting children from birth to 3 years of age, advocacy, supports coordination, guardianship and representative payee services, which support individuals throughout their life, a variety of individual and family-focused support groups and programs. In addition, the ARC Alliance is a great resource for support on a wide range of issues and concerns. For more information, please visit our website at www.thearcalliance.org. I'm often asked how a person or a family can get more involved, and the simple answer is to become a member. Go to our website and use the contact form for additional information, and you can learn more ways how you can become involved. Today, we're going to speak with Paul Stengle. Paul, thank you for joining us today.
I am delighted to be here.
Well, we are really interested to learn more about the Pennsylvania state budget process. Can you tell us a little bit about the budgetary process that occurs in the state of Pennsylvania?
Yes, I can. The state budget is being worked on throughout the year by different people. And a lot of people wait until the budget is put out by the governor, the proposed, before they begin to give input. But the budget process really starts in divisions through the summer. And so the Office of Developmental Program, for example, which is part of the Department of Human Services, begins to do their request in figuring out how much funding they need for the next year during the summer. In the fall, generally, those recommendations go to the secretaries. So the Secretary of Human Services, sometime in September or October, will get the request that the different departments make. And they'll put the figures together and submit it to the Office of the Budget in December. And the governor will give his final approval of the proposed budget, and it will go to print in January, and it goes to the legislature on non-election years, the first Tuesday of February. Then the legislatures will have appropriation hearings on the budget, and they are supposed to approve the budget by June 30th. And if it does not get approved, then there is difficulty in the state expending funds, and it can cause some shutdowns. So at any point in the year, someone's working on next year's budget. Being February, the governor did submit his budget last week to the legislature, and appropriation hearings are being scheduled, and hopefully we'll get a budget before July 1st.
Excellent. Can you tell us when it's important to contact administration and the legislator concerning funding issues, if they're working on it the whole year?
Well, Again, it's easier if you get the funding in the budget early than trying to get it in late. Generally, once the governor submits the budget to the legislature, it's very difficult to get additions. So you're better off if what you want is in the budget. So I think it's important, and you can either write the department heads in the summer, or you can even write the governor and say, we want these funding issues addressed. If the governor gets a letter like that, he will submit it to the budget office and to the department that is requesting the funding. And again, the secretary level for us, that's usually the Department of Human Services is most important, but we're also concerned about housing issues and transportation issues. The funding needs for developmentally disabled individuals and individuals with autism cross all lines of the budget. So again, early contact with those departments and the governor is helpful. Once it gets to the legislature, again, contact your own legislature and ask for support. To be honest with you, there's probably about 12 people who approve the legislative budget, and they're the leadership of the Democrats in the House and Senate, and the leadership of the Republicans in the House and Senate. Okay. If you have relationships with the leadership, it's a good time to be pushing those contacts. Not to say it doesn't help to get a freshman legislator involved, but generally the House passes one proposed budget and the Senate passes another proposed budget, and it goes into conference committee, and the leadership is expected to carry their party in approving what the committee decides on. So again, it's important to contact your own senators and House members, but it's also important to contact leadership. You can also ask your state legislator or senator to contact leadership, because frankly, if you're a member of the Senate or House, you have more influence with the leadership than usually a general citizen has. So that's the process.
Very informative. Can you talk about how best to present your argument for increased funding for persons with a developmental disability or autism?
Senators and House members are bombarded with data, and I don't think data is the best way to approach them. I think it's much better if you have a personal story or know of someone who has a personal story to tell that story. If you're going to visit a legislator in person, and if you have a child with disability, I would definitely bring the child with disability to the meeting. Every elected officer I met wanted to be elected because they wanted to do good. And we have a very persuasive argument to fund people with developmental disabilities. But a lot of people don't understand the issues. And the best way to understand the issue is get to know someone who is developmentally disabled or has autism.
Is it important for one to know all of the details of the budget in order to advocate with your legislature for more funding?
No, you just need to know what you want. There's appropriation committees and appropriation staff, and the governor has a lot of staff. They can figure out how to fund it if they want to fund it. So it's important for you to be able to articulate clearly why you need the funding. For example, I need transportation for my son so he can get to his job, so he can work and be more independent. I don't think you have to explain where that funding needs to go or necessarily how much the funding can go. I used to know an appropriation chair in the Senate, and he used to tell people, where do you want me to cut it? And he would throw a 400-page document at him was the appropriation. I think he did that for entertainment more than for actually expecting a response. But again, if they want to fund it, they'll find the funds to fund it. And I don't think you have to worry about the deficit or taxes. I think what you have to worry about is making the request clear, what you want the funding for, and they'll definitely figure out how to do that.
Now, are you optimistic that this administration and legislature will be able to come to an agreement on increased funding for individuals with IDD and autism?
Well, the bad news is last week the governor's budget came out and there was significant funding for maintaining funding that came available during the COVID, but there is no additional funding that isn't in replacement of the funding that came about through COVID. And the federal government passed through a lot of money. Providers have used that to address a number of issues. The state is setting their priorities, and they want to maintain that effort. So the good news is the increases we've gotten this year seem to be maintained next year. But in general, besides that funding, it's been level funding, which is a sad thing. Hopefully, we can get the legislator to increase some funding that's in addition to just replacing what would be lost next year.
Absolutely. It's so important. Now, when we talk about funding, is it more of a state issue than a federal issue or vice versa?
Well, funding is important both on the state and federal level. However, most of the funding for people with developmental disabilities in Pennsylvania comes through Medicaid funding. And the rules on that is if you're eligible for Medicaid and the state requests the funds, the federal government matches it. So in order to get more federal funds for community programs, most of those funds are going to be coming through Medicaid. And in order to get that funding, the state has to put up their match. And that's probably about 42% state money, and the federal government matches at 58%. It's a mandate. If the state asks and they get the funding, the feds have to provide the match.
Wow. So can you tell us more information about how President Biden's Build Back Better America plan would address funding issues for persons with IDD and autism?
We have had for years, and COVID has made it a tremendous crisis. We cannot, providers of group homes, residential providers, individuals giving employment options cannot recruit the staff necessarily to meet the needs of the people they serve. Build Back Better that is being sponsored by Biden and would put a large amount of money into Medicaid so that the states would be able to access that money to address the salaries. So that will have a significant impact. And President Biden and many of the senators and legislators on the federal level are supporting the funding, and it certainly would give us the funds that would substantially alleviate the problem of recruitment and retention of direct care workers.
Absolutely. And what's the timeline on that impacting, some of the individuals that we serve?
They probably have another year to pass it or modify it. Again, I think that President Biden and the Democratic Party are cutting their initial recommendation. I'll be honest with you, I think the funding for direct care staff is not the highest of their priorities. I know that they cut off the funding for community colleges, and they'll be looking for more cuts. So it's a very important time to contact your federal legislators and say, we want the funding for direct care staff working with individuals with developmental disabilities to pass and be funded. It would be, again, very helpful for us to address a crisis that is out of control.
If the funding issues facing people with intellectual and developmental disabilities and autism are not addressed. Do you foresee a crisis and provision of community-based services?
Well, we've seen it, and one of the things we've seen is if you are awarded funding and you're on a waiting list and the state funds you for programming, we are unable to locate providers who are interested in providing the new service. They're trying to maintain and protect the people they're serving. Because of the low salaries, they can't recruit the staff. So individuals who are approved for funding are not getting the services because the services don't exist. It's more difficult to take people from institutions and put them in the community for the same reason. Most providers are saying we're not going to accept any individuals until we can assure quality services to what we're delivering. To the crisis, there are people who have died because staff weren't there to provide the supports. It's been a nightmare for people who, like us, who are providing service coordination and advocating for people. But I know of an individual who has cerebral palsy, lives on his own, but he needs support to cook, to get into bed, to get dressed, etc. And one of his staff had COVID, so he was told they would not provide services for 15 days because he had to be quarantined. He needed services. He ended up going to the hospital and spending a few weeks in the hospital. And again, we know of individuals who died because staff did not show up, and without support, they could not maintain themselves.
It's just awful. Everything seems to have been exacerbated with the pandemic as well. We were already at a crisis level, and it's only become worse.
Yeah, employment, trying to employ people during the pandemic has been extremely difficult. A lot of people don't want to be exposed. A lot of people decided they're going to weather it out and not work. And so the demand for staff far exceeds the availability.
It's a shame. Why is there such a discrepancy between the funding of institutions as opposed to the funding of community programs? Specifically, the institutional costs are 3 times more than the cost of community-based services?
There are a lot of reasons why institutions are more expensive. One of the reasons is the infrastructure of the institutions need a ton of maintenance and upkeep. Most of the institutions were built in the 1920s, 1930s. There's problems with lead piping and lead in the water. Most of the remaining institutions have special teams to address the asbestos problems, because if you get a leaky roof, the asbestos gets released. But the facilities are run down and old. The other major cost for institution is you get everything when you go to an institution. So you get nursing care, you get your food cooked for you, you get everything. And a lot of people can cook themselves. A lot of people have skills. So when you go into an institution, you get everything whether you need it or not. And if you're in the community, you may be able to provide your support yourself or have other members who are willing to help you with that. If you're living with your family with a minimal amount of support, the family can maintain you.
Right.
One of the major differences in price of community and of institution has been the salary of staff. The staff in state-run institutions have a great pension plan, are probably making close to $20 an hour, a fantastic medical plan. And when you look at people who are working in the community, I think the average salary is probably around $13 an hour.
Wow.
There's not defined benefit plans for retirement, and that cost is a big lift. Now, I don't want to argue that communities cheaper than institution, because a major reason it's cheaper is staff, and we need to pay staff.
Mm-hmm.
But it's also cheaper because we don't have the upkeep of the facility in the same way.
Right.
And people can choose what they need and don't have to buy the entire package. So that's a major part of the cost differential.
Absolutely. And then no one's spending money on services that aren't needed.
Right.
So the funding through the Pennsylvania state budget that we talked about the process earlier today, by increasing funding, it can help address some of these issues.
The number one problem with recruitment is salaries. If you're making $13 an hour to assist people in a group home or in their own home, and you can get 15, 16 by working at Starbucks or McDonald's, the work is tough.
Mm-hmm.
You can be helping people with bathing. You can be helping people with behavior issues. And again, it's very demanding. Where you go at McDonald's, you leave and you're done for the day. I don't want to make people think McDonald's is where they should go. They should work in our programs. But there's a lot of rewards in doing that. But if you're a single mom, your options aren't to do what you want to do or like to do. You have to address your financial needs of your family.
Absolutely.
And many of our direct service staff are below the poverty line for what they get paid, and have to get benefits like food stamps and chips for their children, etc. And if we're going to maintain the community system, we have to address the staffing issues.
Absolutely. We've learned a lot today about the budget process. What haven't we touched on that is important that you'd like to share with our viewers?
Well, again, here's the time for you to call up your legislator and say, I'd like to meet with you. Send them a letter and say, I want additional funding for people in the community. I know a lot of legislators say we don't have the money. I can tell you parents with children with disability are willing to pay more taxes if it means that people with developmental disabilities can get the services they need. So it's important that you give that message. I'll be honest, most people vote not for funding for developmental disability. They vote military, the deficit, guns, pro-life, etc. And we need to start voting developmental disabilities. Probably 1 out of 10 families in Pennsylvania have a child with a developmental disability. 3% of the population has IDD. Probably about 1.5 to 1.7% of the people have autism. We need to speak with one voice and let the legislature know we want appropriate funding for these services.
If somebody wants to contact their legislator and find out who they are, what's the best way to go about that?
Well, if you go onto the webpage of the ARC of Pennsylvania or the ARC of US and put in your address, you will get who your federal and state legislatures are. You also will get a choice of a number of topics, and you can pick a topic that's important to you, like waiting list, and it will give you a draft of an email addressing the waiting list issues.
Great.
You can modify it, and I hope you would modify it. And if you have a story to add to it, I would hope you would add a story. But if you just want to send it out, that's fine too. If you're writing a personal letter, it's important that you state up front what the issue is. And if you state too many issues, they're only going to put it in one pile. So they have someone sorting the letters and they go, okay, waiting list here. Now, if you have the waiting list and you want to also fund direct care staff and it's further down, it may not get it won't get put in two piles. They'll choose which pile to go to. If you write your senator or legislators, they have responses to different issues to tell you what they're doing. And I sometimes make the mistake and address more than one issue, and then I get a response that I don't understand. But if you tell them a good story, I know that some of those letters get put in the pile for the legislator to read.
Okay.
Generally, the legislator does not read them.
Great, but a good story will help get their eyes on it.
And I guess the last issue on the legislators, personal relationships are important. So I would, again, if you have a child with disability, introduce them to the legislator. And I also would have personal contacts.
Great.
We sometimes don't like talking to people. The closer you are to the legislator, the better it is for you to convince him to support your issues.
Great.
So arrange for contacts in the local office. They'll meet with you and tell them your story.
That's excellent. Well, this has been really helpful to help us figure out how to, have conversations or to approach our legislators about the Pennsylvania state budget so that we can get that really important funding.
I would also stress that if you're talking to your legislature, be polite. Even sometimes you want to get angry. And if you have a meeting scheduled, it's important that you get there on time. They're scheduling them at 15 minutes or half-hour meetings. When you're done with the meeting, it's always good to write a little thank you card saying thank you. It's also important when you're talking to your legislators to ask them, are you going to support what I'm requesting? They're very good at not answering that question, but once they answer it, usually they stand behind what they promise.
Okay, that's great. Great advice. Thank you so much for being with us today, Paul. This has been really very, very helpful for all of us. Anything else you want to touch on before we wrap up?
No, again, we count on your support. We are a family-driven organization advocating for our children, and we hope we can count on the general public and other families with children that have a developmental disability to support our efforts.
Excellent. Well, thank you for joining us today. I hope that it was an informative and beneficial program. I know that it was for me. I learned a lot today. If you're interested in getting involved with the ARC Alliance and help us achieve our mission of full inclusion, or if we can be of any assistance, or if you have any questions, please feel free to visit our website, www.thearcalliance.org, or call our office at 610-265-4700. We look forward to being with you again next month.